and then I will drop off. So we'll just give it a minute as people jump in. We are streaming live to the lobby. My eyesight is terrible, so I can't see. I can see Brent. Brent is in the house. All right, we'll see who else hops in. All right. All right. We got a few hopping in here now. It's Friday night of the long weekend. Why wouldn't you want to be here talking about this with us? Oh. There's going to be a little reverb until I let you just do your thing because we're broadcasting this one. You know what? I am just going to let Sean do his thing. He can introduce himself and we will enjoy your presentation, Sean.
Sounds good. Thank you, Mike. I'm going to share my screen just before I get started so that y'all can have that. Oh, no, I'm not doing that. I'm doing slideshow. There we go. Okay. Hopefully everyone can see my screen as well as myself, if that, or you can shut the camera off on me. Okay, great. So my name is Sean Burr. I am very happy to be here with everyone this evening at the end of the conference. I am a clinical social worker by training. I'm also doing my PhD at the University of Houston in the School of Social Work. Can you hear me? Oh. Okay. Is that okay, Mike? Can I keep going?
Yeah, we're good.
I hear that kickback. My area is suicide prevention and intervention. So that's why I'm very excited to speak tonight and share a little bit about my passion and the work I've been doing. My topic tonight is male socialization and suicide. Let's talk about it. So we'll have some time at the end also for questions and some dialogue. Mike's let me know. So I'm excited about that as well, because I know there's a lot of people, a lot of expertise viewing this evening as well. So we'll start off. You guys heard from the beginning, I'm a doctoral student and a clinical social worker. So my objectives tonight to share with you in the time I have is to talk about suicide in Canada, and particularly suicide in men. I'd like to talk about the risk factors for men and suicide. And then I want to talk about why men, particularly the psychosocial factors, why men might be vulnerable to certain psychosocial factors. And in that, kind of introducing this idea that's been around male socialization in the context of suicide prevention intervention and how we can maybe think about that. We're going to end with some suggestions about how to address male socialization in the context of suicide prevention, and maybe hopefully if the time comes, to support some men in your lives who could use some of these conversations, which can be difficult. So when we look at suicide in Canada, definitely a significant public health issue. About 4,000 people die annually. 2019, 11.5 per 100,000. So that's on track with that approximate 4,000 per year. So this is the gendered piece, and we're going to keep coming back to it as a way to highlight, not necessarily for comparison, but we're going to highlight these differences a lot in the presentation. So men accounted for approximately 3/4 of these deaths. So the rate is 17.8 per 100,000 versus 5.1 per 100,000. So a big difference. Middle-aged men between the ages of 40 and 59 have the highest rates of suicide in Canada, and Indigenous people in Canada, particularly the First Nations and Inuit, are significantly higher risk. And their rates are really shocking. I mean, for the Inuit, they can be into 60 per 100,000. So some very, very shocking numbers in terms of rates of suicide in those communities. Of that 4,000, though, middle-aged men, particularly white men, take up the bulk of the deaths. So and this is from the Canadian Association for Suicide Prevention. I circled a couple things because I'd like to show you across the lifespan how men fare. So for children and youth, 10 to 19 years, men account for 41% of suicides from the 10 to 14-year-old 10 to 14-year-old range. So that's the only time across the life course that we see females actually proportionally suiciding at a higher rate than males. As soon as we see 15 to 19, males then start becoming 70% of that population that die by suicide. When we go into young adults, so the 20 to 29 years, we see 75% of suicides are male. When we go into adults from 30 to 44, we see again 75% of suicides are male. When we go into 45 to 64 years, that's 73% of suicides, and it's also the highest rate across lifespan for 45 to 59-year-olds in that space. So they're accounting for a huge proportion, but also we see a huge increase in rate in that 45 to 59-year-old range. And then seniors, males account for 80% of suicides. And we see the highest lethality in males aged 85 and older. So again, when we're thinking about this, this is starting at age 15, going all the way into our 80s, men die at a higher rate of suicide comparatively within the genders. Now, it's important to note in all of these graphics that they are attending to something, and we're going to actually talk about this. Self-harm and suicide attempts, females outnumber men, self-harm is at a higher rate for women, but the lethality is on the side of males, and we're going to look and maybe try to understand that a little bit more. So this gender difference isn't just in Canada. So in the United States, men die by at a rate of 3.87 times more often than women, so about 4 times more. And in the US, there's not as much data in Canada, but in the US, we see across races this is true. So American Indian, Asian Pacific Islander, Black, Hispanic, and white men all suicide at higher rates compared to women of the same racial backgrounds. So that's important that we're seeing this across racial groups in the West. In the European Union, again, consistently, men are suiciding at a rate of 4 to 5 times higher than females. Globally, this gender difference is still observed, but we do see some difference we don't see as high as we would say in some of the Western developed countries. Suicide rates, male to female, is 1.9. So male suicide at a rate 1 times more than women for every 1 suicide. So this is more of a sociological thing, but we look at parts of Asia where women are suiciding at higher rates than males, and this kind of can maybe get back at some of the crux when we're thinking about what we're having going on here locally. Why are males here having this challenge? And this, in the literature, this is known, and there's articles and commentary on it, this gender paradox of suicidal behavior. And it's a paradox still in 2023 because we don't fully know why it happens. But we're going to maybe talk a little bit more about some of the ideas that we can and how we can apply some of the thinking around it. So what are the risk factors for men? So Richardson, recent study, relatively recent, last 2 years, did a systematic review looking at the different risk factors for men over the life course, and they found 68 different risk factors, which is a lot. But the key factors that they flagged were alcohol and/or drug use and dependence, being unmarried, divorced, widowed, or single. So that relationship status, diagnosis of depression, and low levels of education. So that's just the one systematic review. Other studies and risk factors for men that have been actually found pretty consistently in the literature is mental health disorders more broadly, not just depression, social isolation, family conflict, unemployment, and retirement. Other risk factors that are a little less studied, but there's still evidence for are psychological factors such as impulsivity, limited socio-emotional skills, self-esteem. Again, these are less studied, but there is still some evidence supporting them. So, question in the literature and for people's thinking, you know, we've had suicide rates going up pretty consistently for the last 20 years in North America. COVID, we've seen a drop in those rates, but we still have reports of increases in suicidal ideation and over the last 2-3 years. But the rates have gone up prior to COVID pretty consistently. We've had this lovely research into risk factors, but other research has shown that even with these risk factors, our ability to predict suicide is actually just slightly better than chance. And so that's concerning, but it also adds up that we have these increased rates and we're not seeing much of a change in terms of actually having an impact on lives saved. The nature of these risk factors mostly is from large epidemiological design. So at a population level, people suicide, and we're saying there's a correlation between, say, marital status, for example, and the person that had died, or they'd be given a diagnosis of depression, for example. Unfortunately, in that recent systematic review I was referencing in the last slide, the authors point to that there's a real limited understanding in terms of the psychological factors and characteristics of suicide in men. So this is a challenge for the field of suicidology in general, because it's hard to get a good sense of stuff from people after they've died. We do have interviews, qualitative work that have talked to people who have survived, and suicide note analyses, for example, but it's not as robust as obviously these correlational studies with large populations. So the risk factors have been really taken from these larger studies. That being said, there's still some value for them, and we're going to return to these risk factors in a second. But first, we want to look a little bit at what people are saying about this gender paradox. So the gender paradox, like I was saying, has been studied before, and explanations for trying to understand why it exists have been proposed. A common explanation has focused on suicidal intent and lethality. So men have more serious intent than women, and they're more lethal than women in this thinking. So women attempt more, but men die more often because they use more lethal means, and they're intending to die. But the second question after this, which is kind of murky, is, but why do men have more serious intent and use more lethal means? Like, what is that? Why would men choose these more lethal means, and why are they more serious in what they're doing in terms of plan? Another explanation that has been put forward is that men simply do not access mental health support at the same rates as women. So, and towards this, men may have a serious suicide attempt, for example, and then they do not report, or this isn't known to anyone. It's kept secret, and then they complete. So, and as a previous suicide attempt is a very, very serious risk factor in terms of chance of death by suicide. So that one's often cited. But why don't men access mental health supports at the same rate as women would be a question. And those are kind of bigger systemic questions. But trying to understand this idea of why would men have more suicidal intent and lethality? Why are men not accessing mental health supports at the same rate? There is a bit of a challenge though, when we just focus on mental health and suicide, and some authors in the literature talk to this need for more of a comprehensive approach in thinking about suicide, particularly for men, because even when issues of mental health access are addressed, men have several risk factors for suicide that we discussed in the previous slides that actually are not in the realm of mental health. Whereas for women, mental illness, depression is a significant risk factor and actually the primary risk factor for women. But for men, there's been studies that have shown that socioeconomic factors are actually similar in terms of the risks they pose for men to mental health. So this idea that we just need to improve access and encourage men to seek help, yes, these are all true, but then we have this whole area of risk where men aren't going to be seeking these supports because they're not necessarily, the issue isn't in that root. It's not at that cause. So when we're trying to understand this gender paradox broadly, there's a lot of, we've been dealing with suicide since the beginning. And there's a number of theories, therefore, to kind of try to explain it. There's a lot of biological, psychological, sociological, psychosocial, biopsychosocial, stress diathesis. There's family systems models that describe suicide and suicidal behavior. So there's a lot there. What I think and authors and researchers have kind of tried to focus on is in the gender theory realm, which is kind of within sociology, that male socialization can possibly give an explanation for this gendered paradox. It kind of can give some explanation for what is happening. So let's look at what we are talking about when we talk about male socialization. So the American Sociological Society Association, APA, they on their website, they define male socialization as such. And I'm going to read it because I'd like to actually deconstruct it a little bit. Early socialization of negative aspects of negative masculine ideals. Western culture defines specific characteristics to fit the patriarchal ideal masculine construct. The socialization of masculine ideals starts at a young age and defines ideal masculinity as related to toughness, stoicism, sexism, sorry about that, self-sufficient attitudes, and lack of emotional sensitivity and of connectedness. Boys learn to be men from the men in their lives, from their own experiences navigating our social norms, and from the large social and cultural context. Boys live under intensified pressure to display gendered appropriate behaviors according to the ideal male code. So this idea of male socialization, at first read, it actually, and I realize they're framing in terms of negative masculine ideals, but when I read some of these pieces around toughness, stoicism, self-sufficient attitudes, for example, lack of emotional sensitivity, there is context where some of these things, not all of them, could actually be positive. Toughness, for example, stoicism, being able to manage one's emotions, self-sufficient attitudes. So I think it's important to qualify where some of these socialization, some of these aspects of male socialization are actually problematic, and where they're actually helpful, and what a healthy masculinity could be. It's difficult though, because again, we're this conversation's in the frame of suicide. So it's kind of balancing and trying to navigate where there can be a resiliency framework and strength-based approach versus kind of honing in on those aspects of male socialization that can be problematic and hurtful to the person in question. So for myself, when I think about male socialization, I like the idea around that male socialization is the societal, familial, and internalized gendered role expectations for men such as needing to be physically aggressive, stoic, economically successful, that create a particular vulnerability to suicide. And I really like the idea of the internalized gendered role expectation. So it's, what does the man in question, or the person, the friend, the family member, the patient, what have they internalized? Because each person in their journey and their story is completely unique and different. So it's very, very important not to do a one size fits all when we're talking about male socialization. There are some patterns, but it's not a one size fits all in each culture, each background, the diversity. There's a lot of different things at play here. So it's more important to think about what is the male socialization process for a particular person and for yourselves. And we're going to talk about that. Cultural concepts such as toxic masculinity, some authors have identified, and I've seen this in practice, that it actually can be a barrier for men to receive necessary mental health support, because it can influence the self-perception that they do not require professional support. And I've also seen it that they might not deserve professional support, that this idea that some of these pieces around their masculinity are actually hurtful to others and to themselves, but they need to keep that to themselves as opposed to opening up and exploring it. So a long discussion as I've worked through it here, but male socialization is complex. I think we're going to get into what we can do. And as we can see on the right side, that awareness of male socialization, what I think is important to focus on in terms of some of the general things I've seen in practice and through my reading, is the idea around self-reliance, the idea of being financially successful, and this emotional guardedness, or this stoicism that's referenced a lot, of keeping the emotions to oneself and not sharing. Those are the awareness aspects of male socialization that I think are very important. In terms of the psychosocial risk factors for men in suicide, I think it's really important that we keep in mind changes to relationship status, changes to finances and employment, and changes to physical health. So when we think about this awareness of the psychosocial risk factors, this awareness of male socialization, this can allow us then to have confidence in the conversations that we have with someone that's struggling. And that can be anyone in your life. Husband, brother, friend, co-worker, but just being aware that these factors, these changes in the psychosocial environment of a person, of a man, and then these socialization processes can really produce a real risk for suicide and self-harm. So what can help? And this is for this can be for anyone, male, female, or however you identify, this idea that there is a male socialization process in our culture. And it's good to know your own story or the story of a loved one close to you. So that could be a father, brother, cousin, a friend. What is that socialization process, that programming they received when they were growing up, and from the culture, and how do they think about that? It's important to know that for yourself or a loved one, so that you can be confident in these conversations. The other piece is to know that men do have a particular vulnerability, psychosocial vulnerability to suicide. So although there's a lot of social messaging and it's important to know that there is a lot of equality and equity amongst the genders, it's important to really recognize that for men, some of these psychosocial factors like losing a job or getting divorced can pose a significant risk for a man's safety in their life. Lastly, when you talk to a person who is maybe going through this experience, it's very, very important just to listen, to normalize, and encourage them to keep talking, and when appropriate, to seek help. And that's from my experience running, being privileged to have sat in numerous men's support groups while working in Edmonton. So that listening to the experience and asking those questions can be a real difference for a person who might be struggling privately with thoughts of hurting themselves or taking their life. Thank you all for your time, for listening to me, and I'll let Mike, I think, go from there.
They're all clapping. They're all clapping. Wait, you caught me off guard.
Yeah, I caught you.
Vaughn, you got a question? Give me one. We got one. We're gonna be a little. Oh, I can't read this. My eyesight is terrible. What in the literature discusses finances, money, distress, and suicide? Is there a comparison based on social political differences? Love you, brother. That might have been Christian.
Is there when we're talking about finances and is there a difference in political affiliation or social thinking? Like, or is that what I understood? Like, is there a relationship?
Yes.
Okay. I don't know. I haven't seen that, but that would be curious. I know from practice, I've sat with men in conservative, more Republican, right-leaning spaces and liberal spaces. I think some of those social expectations, I'd say for men more to the right can be harder in this conversation around suicide, but I have not seen that overlap between finances and political affiliation, but it would be really neat to explore to see if there is a difference. Because a lot of those values do tie into personal values when we're talking about those political values at times. Self-sufficiency, reliance, for example. Maybe someone's done it, I just haven't seen it. I'm sure they have, but I haven't seen it. But pretty cool to think about in this male socialization conversation.
Sean, thank you so much for sharing with us. That was fantastic. We were worried the band was starting here, but I think they were just warming up. They're on a little later. All right, friends, we are going to hop back into the lobby, and we've got Dan's son coming back right away. 7 o'clock, he will be on sharing his art. So join us back in the lobby, and we'll see you soon. Thanks again, Sean.
Thank you. Bye, guys. I'll be in the lobby if anyone wants to chat.